Hello, I'm Dr. Mohsen Kazemi. I'm a chiropractor with fellowship in sports, fellowship in rehabilitation, master's, and a PhD degree in sports sciences. I would like to share with you a taping technique that I developed and copyright and trademarked it. This taping technique is called Leukomizer taping technique. Let me share my screen so you can see that. So this is the technique that I developed and trademarked in 2018. However, about 25 years ago, a chiropractor showed me this kind of using Leukotape for acromioclavicular joint sprain and sacroiliac joint sprain. Later on, I continued to work and use this taping and kind of develop it for all other joints, tendons, muscles, and ligaments. I went back to my notes to find out who the chiropractor was, and looked on the internet to find out who it was that started this and showed me the utilization of Leukotape. But unfortunately, I couldn't find it. But I decided to continue and use it and develop it to cover the whole body. During the last 26 years, I have been using this technique and teaching it to my students at the chiropractic college and my sports residents, again, at the chiropractic college. This technique is very, very efficient and very different than other technique. The use of Leukotape, because it's a very, very strong tape and very sticky, it is very good to decrease extra movement, to restrict movement, to stabilize the hypermobile joints, and also to activate the muscles around and to enhance the stability of the ligament around the joints. The beauty of this is that it only requires 2 pieces of tape. So for me as a team doctor and team chiropractor for Taekwondo team for many years and being an athlete in Taekwondo, traveling with the team during last 20 years, and the fact that when the athletes gets injured during the sparring, we only have 60 seconds to take care of the athletes. Using only 2 pieces of tape, it really helps if there is any sprain, strain that I need to stabilize so the athlete would be able to continue. And it has been very effective for this very purpose. So in 2019, 2017, really, I decided to put everything together and make a manual and also give it a name and trademark and copyright the manual. So the name that I gave it was Leukomizer. I'm also the inventor of the Kazemizer shark instrument-assisted soft tissue therapy mobilization tool and technique. So in light of that Kazemizer, I give it a Leukomizer. And it's funny, one of my residents give me a mug with my face on it, with my picture on it. I call it Leukomizer. It's great. It's quite a funny one. But anyway, so the name is Leukomizer, and this registered taping technique. And what I was going to go through many different series of videos for you to go over how is it being used, how, and probably we'll do videos on all the joints that we have, so how to use Leukomizer to address different joints, muscles, and tendons. So we do use a leukotape. And leukotape, as I said, is very strong and stiff adhesive tape, which is great for restricting movement of the joints and ligament, tendons, and muscles. And it is very efficient and effective taping because it only takes 2 strips of tape. It's very fast to apply and stays for a long time. The indication for it definitely is sprain and strain. Tendinopathy is another one. Hypermobility, instabilities do very well with this, and muscle activation. So you may ask, is there any research on it? Unfortunately, not on Leukomizer. I am developing some research objectives to compare it to different taping technique to see if what I say it comes true. But definitely has been used before as McConnell taping for the knee, which has been in most of the study has been shown to be very effective for PFPS and the movement and of the patella. So, well, what you need to be very careful when you use leukotape is that it is because it has lots of latex. So anybody who has a latex allergy, probably skin irritation, psoriasis, over the psoriasis area, over the infection, over the open wound, you definitely do not want to use this. In case of latex allergy, you can actually use stretchy tape, Hypofix, which is a hypoallergenic white tape that you can use underneath and then use the Leuko on the top of it. The other way that I use it at this point is actually I use hypoallergenic stretchy tape, kinesio tape kind of taping what they are hypoallergenic underneath. And then I would use Leuko tape on the top of it. And the reason for it is that I found out that the Hypofix sometimes is not as sticky and it doesn't stay, whereas some good hypoallergenic stretchy tapes, like a spider tape hypoallergenic one, usually stick much better for this. All right, so what are the principles of using Leukomizer? First of all, anyway, in any taping, you need to clean up the area of the application of the tape. The most important part of this is to make a tag. So you will see in the picture here that there is a tag that has been, and so this is working on the acromioclavicular joints, especially if there is sprain. You will have the patients to bring it to the shortest position, so maybe here to lift up the shoulder, and then you make the tag and you apply it over. Now, it's very important with the Leukotape or a stiff tapes, the direction of pull are very important. The stretchy tape, you stretch them and you pull them, but it says stretch that would take it away. But this is a stiff, very stiff tape. So the direction of the pull, it will really help for this, the way that you want, or in the direction that you want to restrict the movement. So you put that, you put the tag in there, and then you would put so you put the tag, you do the pull in the direction that you want to decrease that movement the most. For example, for here, for acromioclavicular joint, then a step deformity, it will go a little bit on the deltoid, and then we pull it over the AC joint, and then pull it over, and we kind of hold it in that position to decrease that step deformity. The next one is to make a Y. So you grab it, you tear it, you make a Y, and I will tell you why. So you put you make that Y, and then you apply the bottom part of it right over here to the area that you want it, and to the tag. And then with this, you can actually pull on the tab even further to make more restriction, and then you apply the rings of that Y to the area that you want to be activated or more restricted. For example, in AC, one goes on a upper traps, and then the other one would go over the clavicle, or you can bring it slightly down over the pec. So you'll pull it down, activate that way. Okay, so the concept is the tag. The direction is very important, and the Y shape is the one that would get you. Okay, so this is the intro, and it is the basics of Leukomizer tape job. In future videos, I will go through different areas of application of Leukomizer. I hope this helps you. This is an amazing technique, but definitely be very careful with the allergy reactions and all of those. It can stay on the patient. That's the beauty of this. Can stay for 3-4 days at least, and provide that stability that they need. Okay, I hope that it helps. Thank you for watching, and you can always contact me if you have any question. Dr. Kazemi at drk.ca. And you can also follow me on my website, drk.ca, where I actually post these videos, and you can also look at it on the YouTube. Thank you, and I hope that you will be able to use this and bring more health to your patient and your people. Yeah.